Hello, and welcome to Office Hours, the podcast where we answer the business questions you're too afraid to ask. I'm Sophia, a student here at King's College London, and your new host. In each episode, I'll be chatting with experts to break down complex concepts in a simple and relevant way. Today, I'm joined by Lara Lewington and Professor Gerry McGivern. Lara is a British tech presenter and journalist, best known for her time on the BBC show Click. She's also the author of Hacking Humanity: How Technology Can Save Your Health and Your Life. Gerry teaches public services management and organization here at King's Business School and has written extensively on how to improve management, organization, leadership, and regulation in public healthcare services, particularly in the UK and East Africa. We're just past the halfway point of the semester, and I reckon quite a few students, myself included, have sacrificed quite a bit of sleep and maybe even pulled an all-nighter to get assignments finished. I'm now trying to wrestle my sleep schedule back into shape with an app that claims to use AI to analyze my sleep patterns and tell me how much rest I really need. But sleep apps are just one small part of a much bigger story. In Hacking Humanity, Lara explores how AI, gene editing, and wearable tech are reshaping what it means to be healthy. The goal isn't just to live longer, but to extend our health span, the years we live in good health. We'll be asking, should we be excited or cautious about this new era of health technology? Who benefits when medicine becomes more personalized, and who might be left behind? How can we protect privacy when our most intimate data, from sleep to DNA, is in play? And what role should public policy take in making sure innovation actually improves care? My office hour appointment is booked, so let's dive in. Lara and Gerry, welcome to Office Hours.
Hello.
Nice to be here.
Let's start off with a broader question. When people hear about AI, biotech, or digital health, some people are really excited, but some people are also really fearful. How do you see it?
I think it's a really good point because people are absolutely divided and tend to feel very strongly one way or the other. Now, what was really interesting to me just now is you talked about your lack of sleep. I thought initially I was writing a book for older people who might be worried about aging, who had a loved one who had dementia, cancer, any other condition, and they were maybe nervous themselves about what might happen. And what I've learned since I've been out talking about the book is how much students and people in their 20s are now thinking about all of this. And it's great to see people wanting to take their health into their own hands. And I think technology is actually a large driver for that. And there's so much that wearable can tell us that is way beyond how many steps you did yesterday in really understanding your patterns and how any changes you make in your life can actually be measured.
I think, like Lara, I think there's going to be huge opportunities here. So I think something that Lara talks about in the book is the Zoe app, which is an app that helps you eat better and become more aware of how eating different things and doing certain things affects your blood sugar and your microbiome. That's something I've done myself, and it's subject to kind of critiques. Personally, I feel much better having taken part in that. I'm eating much better. I feel my sort of blood sugar is much more stable. Again, that's been very interesting to me as a person who's used that, to see how that can have such a big effect. And I just feel better. Who knows how it's going to impact me in the future, but I'd like to believe it's going to reduce my chances of not being ill in the future.
It is also the fact that you can feel better now as well as protect your future health.
Yeah.
And I think in many ways, that's often the greater motivation for people because we need to get through each day at the same time. And when I interviewed Brian Johnson, this guy who's spending millions trying to reverse his biological age in the US, this tech entrepreneur who's now had quite a lot of publicity, but I've been the first person to go and interview him, so it was all new then. When we left his house, my colleague said to me, oh, that all looked utterly joyless. His regime of working out until he was almost going to burst, tracking everything, doing a load of treatments, blood plasma exchange, all sorts of things. But I said, I'd like to be a little bit like him. I just wanted to take away a little bit of that changing my life and feeling better from it. And I suppose, Gerry, like you've said, the idea of knowing what is better for you and being able to embrace some of it, those bits that work for you, is where this can be transformative. We also need to live. We need to enjoy ourselves and be happy and not just feel we have to follow a set of rules, but technology can guide us to which bits might actually be helpful to us.
I think it's obviously you talk a lot in the book about sort of data. So again, from a personal point of view, it was really interesting to me to see the blood sugar spikes I was getting. I still have pasta, having kind of seen the kind of huge blood sugar spikes it gives me. At one point, I had a bar of chocolate and some kind of soft drink as well, and the blood sugar spike it gave me there was just incredible. And it's seeing the data and seeing the effect it has on you is just something perhaps you can never unsee. So that, again, that's been very powerful. I think that's a really interesting example of how seeing data at a kind of personal level can actually lead to changes in your lifestyle.
The added thing here, I think, is that we all react differently to things and our habits are different. So one thing I found with a continuous glucose monitor was the vegetable juice I was having before lunch. There was no cheating, no fruit in it, pure vegetable, was the biggest sugar spike I was having of the day. Whereas after dinner, if I was eating dessert, especially when some of the time that I tested one of the CGMs, I was on holiday and I was having an ice cream after dinner whilst walking, my blood sugar wasn't going out of range. I'm not saying ice cream is good for you. And of course, the spike did go up a bit, but it didn't go out of the specified range, whereas that vegetable juice absolutely leapt out of it. And we can consume the same things in a different order and have a completely different effect from them. And so having that data on ourselves, on our habit, can be so motivating. And every form of data probably isn't going to be as motivational for everybody, but it's all about picking and choosing those things you can do.
I think there's also kind of critiques of people getting health anxiety, so getting worried about sort of blood sugar spikes. If you're not pre-diabetic or diabetic, there's a question, I think, about how dangerous are these things? Are people overreacting to them as well?
I spoke to quite a few people who were then trying to keep their blood sugar totally level. Your blood sugar's meant to go up and down. It's about
Absolutely,
not having huge spikes and huge dips. And so this is something I think across the board with all sorts of health tech and monitoring that we can do. We can all sequence our genome now for a few £100. That cost $3 billion back in 2003 for the first person during the Human Genome Project. But how useful is it to each of us to have that data? And in time, that information will become extremely valuable within healthcare for personalising medicine, for understanding more about disease risk. But right now, it can send us into absolute panic because there's very limited amounts that are really useful and actionable. Actionable data that is reliable is crucial here. It's not just about collecting any data. It's got to be the right data that we can do something about.
Gerry, I found the point, what you said about seeing the data really interesting, because I think for a lot of people, especially for young people, as you said, Lara, like we think, oh, like we're young, we can sleep late or eat unhealthy and our metabolisms will deal with it. And we just, since it's in our body, we can't see it. So then we're like, oh, that's out of sight, out of mind, right? But when you actually record the data, that's bypassing that, right? Like you can actually see the data and you're like, oh, maybe I shouldn't be having that ice cream right after dinner. And what you said about young people getting more into health, I think it's definitely true. I think amongst my friends, I've noticed that more and more people are going to the gym, whereas when I was maybe like in secondary school, like maybe someone would be like, oh, I'm going to the gym. And everyone else would be like, why would you do that? Let's move on now to the core discussion. So I want to begin this section by discussing the affordability of health tech. And Lara, you've mentioned a lot of exciting technology in hacking humanity, but another point that has been mentioned quite a lot is also like costs involved and also whether people are able to afford this technology or not. There's a really great quote from Hacking Humanity: health means wealth, not wealth means health. I really like that. So my question for you is, who benefits and bears the costs of innovation?
There's many different ways we can look at this. First of all, if we talk about prevention, saves a lot of money and is a lot kinder. It doesn't mean that it's that easy to switch from a system of sick care to one of healthcare. There are different pots of money. This is not a simple thing to do. And this is in Britain a single payer system with a national health service. You take this concept to the US, where it's all about insurance companies, and people are going to be swapping insurance policies. On average, I think it's every 7 years. So a company that paid for someone's prevention, screening, test are not going to benefit from it when the person doesn't get sick. So throughout the world, there are very different challenges within healthcare, as we know. Now, here in the UK, the government 10-year health plan is hoping to prescribe wearables for people who come out of hospital after acute treatment, for prevention and for monitoring chronic conditions. So we're seeing a way of being able to bring a device which doesn't need to be expensive. Yes, there are smart rings that go into the hundreds of pounds, and there are more expensive devices, but you can also pretty low-cost ones that are pretty good. So I think the idea of being able to track ourselves, and look, it's not for everyone. Some people will feel anxious, but there are many trials that are happening making real use of it. People who are having knee replacements, for example, there's some retrospective data being looked at on how much movement people are getting when, so you can better predict recovery and encourage people as to what they can do. These technologies can play a realistic role that isn't going to be at great cost. And also at population level, we're going to learn a huge amount from the data. We have never before been able to collect 24/7 data on such huge numbers of people. And we understand a lot about society and culture as a result of this. Different sleep patterns across the world, prevalence of different diseases. There's examples of how dementia, say, can be seen in sleep patterns 20 to 30 years before symptoms emerge. These sort of tools could start to become an important part in recognising something is amiss to go and see a doctor for further diagnosis. So there is a lot going on. There's also the idea of bringing this to supermarkets level. Someone described to me biological aging tests, which are these tests which you do which assess not your chronological age, but your biological age, how well your body's doing. This could be through inflammatory markers, for example. That these would be brought to supermarket level, where in some of the most deprived areas, where there are some real health lows, we know there's a big socioeconomic factor here, those would be available a bit like lateral flow tests at the checkout. People would pay a few pounds, and the reason they would pay this is for adherence. They would get that money back when they've submitted the test, and then get feedback on their health and what they might be able to do and how they might be able to better it. We need to be able to create ways to give access to people, and to do this at the same time, people need to be educated as to why it matters. So I think there are many people with great intentions really aiming to bring this to the mainstream. And in the UK, we do have the NHS, but we also have women spending on average a quarter of their lives in poor health, men 20%. We need to close the gap on health span and lifespan. Sick people are very expensive to the economy. There needs to be a way to be able to switch this. And kindness isn't enough to make it happen as much as it should be. But there are possibilities. There are also enormous challenges that I think Gerry probably knows a lot about.
I think it's a no-brainer that we need to move away from I think Lara talks about, a sickness to a wellness service. So we're spending far too much money at the moment sort of treating people after they fall sick. What we need to do is to make sure that people prevent as much as is possible getting sick. So I think from a sort of economic point of view, it's, as I say, it's a no-brainer, and the recent government plan talks about that as well. I think also, again, thinking about the sort of the future of healthcare, I think we, if we can, need to take more responsibility for our own health. So that's great for me to say because I'm perhaps more conscious of it, more motivated because I'm at the middle age. I'm perhaps more conscious of my dwindling health span now. So I think that's great if you can afford to do these things. I think that's definitely something to do. It's much better to stop yourself getting sick than getting sick later and being treated. I think there are questions, though, as I say, in terms of affordability. I was talking to somebody about, again, the sort of eating and eating better. And it was really striking to me. This was a person who worked in the NHS as a junior manager who said, I just can't afford to eat good food. Again, it's great, I think, if you can afford to do it. But for some people, eating well is just very expensive. How do you give yourself enough time to look after your fitness if you're working a very demanding job, if you've got lots of children? If you're doing a night shift, obviously these things are quite tricky. I think it's a huge opportunity, but we have to think about how is everyone going to be able to do these things? And again, is the government going to put money into providing technology that is going to prevent people from getting sick, particularly at the time when the health system is really struggling? Again, are we going to fall into kind of short-termism? People talk about kind of firefighting and thinking longer term. So I think we really need to be brave and actually try to prevent people in the longer term getting sick. But again, will governments do that because they've got such pressing problems at the moment?
And the other thing that we're seeing is a lot of pilots in the NHS for early screening of cancer and so many different health conditions are very successful. We see how well they work, but it doesn't result in full-scale rollouts of them. And of course, that's deeply frustrating to know the technology exists. But sometimes, yes, it's saving lives, but the number of lives saved are not enough for that to be the thing that gets pushed through. And there's two ways there's the way of looking at this at a population level as to how decisions are made. And then, of course, it's very tough at an individual level to stomach that when it's someone you love who has been at the hands of something's failing.
Actually, I want to ask you a bit more about, systems. So from a systems perspective, how do governments, healthcare providers, and businesses decide what's worth investing in? And how does affordability shape whether tech lives up to the hype?
That's a big question. I think obviously from a kind of commercial point of view, businesses are interested in investing things that are going to lead to longer term kind of wealth creation and profitability. Obviously, some businesses also have kind of public interest at heart as well. So might be balancing the interest of shareholders and the interest of the public. Again, the government is trying to invest to maximize the health of the population in the longer term, but obviously is under kind of huge political pressures. So sometimes decisions are made for kind of perhaps short-term political reasons rather than necessarily what would be in the best interest of the population in the long term. We're conscious that governments get re-elected every 5 years. And obviously, if we're thinking long-term about health span and prevention, we need to be thinking about 20, 50 years ahead. We need to be thinking about what are children eating at the moment? How is the diet of a 5-year-old going to impact their longer-term health? Because if you become obese in your childhood, as I think increasing numbers of children are, that's going to have huge cost in the longer term. Governments, think perhaps 3-10 years ahead. The new government plan has been published, which is looking forward 10 years. But we need to encourage long-term thinking. But that's really difficult to do when people are not getting treated and waiting lists are very high. So there are sort of these competing pressures when you think about the public healthcare system between doing what rationally would be the right thing to do in the longer term and then responding to very pressing demands that governments and healthcare systems are facing at the moment. So it's tricky. If there was an easy answer, I'm sure somebody would have implemented it. I'm really interested in the sort of timeframes, so how we think about issues through timeframes. And there's a kind of real trade-off. In an ideal world, you want to think long-term, you want to think about prevention. So you think about that 5-year-old child who's having lots of chips and unhealthy ultra-processed food. You want to be encouraging them to eat better, to exercise more, to sleep better, all the things that we know, perhaps not spend so much time on social media in the longer term. But at the same time, you can't leave things for a very long term. So you need to address things in the short term as well, because obviously you need pressure for people to actually make changes. So there's really interesting, we talk about the complex intertemporal tensions. You want to be thinking long term, but at the same time, you want to be addressing things quickly, because if you leave things for the longer term, then nothing may have happened, or things around you might change. As I say, it's a tricky dilemma, but I think it's something that we really need to think about.
Would you say that the way like governments are structured in terms of like elections and stuff is inherently unsuited to efficient long-term planning for healthcare systems?
Well, as I said, I think the kind of short-term electoral cycle does breed a sort of certain short-termism in government, but also at the same time, it puts pressures on governments to put pressure on health systems to improve. So I don't really know if there's a potential solution to that. But again, thinking in terms of what can we deliver quickly, but what do we need to do in the longer term, I think is an important thing. So again, Lara's talked obviously about the importance of kind of health span. And as I say, I'm at my middle age now, so I'm thinking how to prolong my health span.
Oh, I know, I'm feeling the same. We're going to get dodgy knees, we're going to get things falling apart a bit, but what we would really love to be able to do, I'm sure, is be able to prevent or delay disease.
Absolutely.
And AI is giving us the power to understand a lot more about this and to be able to screen better, to understand who is at risk of what, when. Genomics England doing some really interesting work on not just who is at risk of what cancer, but why are some people getting it in their 20s, 30s, 40s, and being able to even predict to that level? There's a lot that we're already doing within healthcare using AI as well. So as much as we talk about there are huge challenges, and those challenges are very real and they absolutely exist, I think we mustn't lose sight of where we're going. We're taking great steps forward. And AI isn't just one thing. Right now in health, it can be an extra pair of eyes that's looking at scans to spot tumours that humans might miss. It can be helping a doctor take notes to allow that doctor to have a more human experience, to actually be able to provide the interaction that someone wants in the short appointment that they've got. Or it can even be used to analyse micro movements and gaze patterns on the face to quantify depression. So there's enormous power in what technology can bring in so many ways, where each a very separate story to that of not everyone can afford to care about what they eat and what exercise they're doing or afford to be able to do it. There's a lot happening, and it's easy to almost not notice the incremental change and look at big headlines every now and then of things happening or fears and concerns. But actually, this is a direction of travel. And whilst there are lots of challenges and it's a wobbly road, there is a lot of progress happening, even down to the efficiency of hospital beds. There are so many ways that AI and technology can help, can play in, and can provide uniform solutions time and time again. For example, robotic surgery. And also helping people understand recurrence rates in cancer to make better decisions over how much treatment is needed when. So there's great progress happening. There are some challenges on the elements of what we can do to help ourselves as well, and they're very clear. But this is an optimistic story long term. It's not magic, and it's not going to happen overnight, and it's not going to be perfect. But there are a lot of things that we can be hopeful about.
Yeah, I think also speaking to the issues around personalisation. So in the past, we've given people generically what is seen to be the best thing for populations overall. And one thing that data can do is that it can personalise the way that we provide healthcare. So for you, Sophia, a particular treatment might be more or less effective. For me or for Lara, it might be very different. We don't want to be giving people broad spectrum treatments. We want to be focusing on preventing the issues that are going to be problematic for you and problematic for me and for Lara, which are all going to be different. And so data can help us do this. I think there's a really interesting, so obviously there's huge amounts of hype at the moment around AI and data. So there are questions about how does this get translated into practice? I think there's questions in my mind about who owns the data. So if the data is all owned by big tech companies, are they going to be incentivized to use this data to maximize their own long-term value and profits, or are they going to think about the interests of the public? So I think there are interesting questions here. But we can't afford to ignore AI and data, big data. It's there. It's going to have a huge impact on the world. And I think we just need to move forward with it in a way that has the maximum benefit to society and people around the world.
Yeah, and data has always been central to healthcare. And this is just data's latest iteration, that there's a lot of it is owned by tech companies. we are now able to do things with more data than we ever could before. It needs to be good quality data that's fit for purpose, collected in uniform ways. There's a lot about the data needing to be right. And there are a lot of sensitivity, those read. Research has shown that people are far happier for the NHS to have data on their health than they are for tech companies too. And I don't think that's just a trust issue. I think it's also this feeling of they don't want tech companies to be making money from them. But of course, when it comes to healthcare, there are huge amounts of regulation, safety and privacy at the core of what's going on. And as long as the correct platforms are used, that should remain the case. There have, of course, been examples of people using large language models, whether it's as individuals, as, say, AI mental health chatbots. It's been even at a caring level where we see social workers try to work out care plans using it, which they shouldn't be doing because they were inputting personal data. So as we're understanding more and more about, and everyone is understanding more and more about how AI systems work, how this data sharing works, there are plenty of large language models that are created within the safety and privacy guardrails that they need to be able to do these jobs. They're the ones that need to be used. This is a new age of data and how we feel about it. And we know what happens when something goes wrong somewhere, where there's a data leak or where AWS has an issue. We've seen, or any other platform, but it's a particularly large cloud platform, but we've seen what can happen when things go amiss. And this increases how worried and nervous people are feeling. There's great benefit to be had here. And most of what we're talking about is anonymized data. It's about understanding patterns. AI can spot patterns that no human ever could. And there's incredible power in this. There is a trade-off going on. And when I was at Moorfields a little while ago, filming a fascinating story about how disease could be predicted by looking at your eyes. And there was a lady there that I was filming with who had Parkinson's. And she was part of the trial. She'd already been diagnosed, but they were in a regular way. But they were using looking at her eyes as part of the study. And what she was doing was an opt-out service for your data. Your data would be used for part of this unless you decided to opt out. And I was talking to her about how she felt about handing over her data. And she just felt it was so remarkable that at a simple eye test, people could discover they had the very early stages of a condition like Parkinson's that she had, and something could be done about it if it was found earlier. It can mean treating something earlier, preventative drugs will get better, how we prescribe lifestyle very specifically, and understanding the impact that has on the body. It makes people think about what their data is actually doing beyond worrying about a tech company potentially having the data. The power of what's going on here at a human level can be really important. And it's no benefit to me for tech companies to be having people's data and earning money. I'm not here to massively support tech companies or anything that they're doing. But I think just in understanding what our data can do, the power of it, and what it really means for people to hand it over. And when you actually talk to people who understand exactly what's being done with it, how it's hopefully being stored, they can actually feel far more optimistic about it than they might do at a superficial level, where people always say, oh, I'm scared of AI. But then you go into the specifics of it and they're often scared of an element, which isn't a bit worth worrying about.
I think, again, if you look at the way that healthcare system's going, so we've got an increasingly aging and sickly population around the world. We've got limited resources. Governments are running out of money. So we can't afford not to use data, whether it's individually, whether it's us thinking about how many steps we've done, what our level of fitness is, what our heart rate variability or VO2 max scores are, and trying to maximize those, eating better, sleeping better, all these things. We, if we can, need to use that more to benefit ourselves, but also to benefit the wider population, because who knows down the line, our health service is going to be there to look after us. So I think it's something that we need to do at an individual level, and we need to do it at a collective level. We need to move towards prevention. We need to preventing people getting ill, because, as I say, unfortunately, the situation is that we're not going to be able to afford to do everything we want to do in the future. So I think it's something we just have to embrace, and I think we have to think about the potential problems, but we have to really, jump on this and use this. It's going to happen anyway, so let's think about how to make this work in the best way possible, whether it's individually or collectively.
Lara, before the recording began, you told us that you were going to take off, was it 5?
5 activity trackers. This isn't normal, by the way. I always wear my watch, which is one of the trackers, and that's because it tells the time and I use it for payment. I actually use a smart ring regularly, but I keep being asked about the other brands of smart ring that exist, because the one that I use has a subscription model and people were wondering about cheaper options. So I have, for the last month, been wearing most of the time 4 different smart rings, to
Oh,
compare
wow.
the results. I've done this with various different trackers over the years, but at the moment it's a lot of rings, which I would show you, but I was made to take them off before this.
Were they all like on the same arm? Like you just had like
No,
9
they were
holes?
spread out. But years ago, when I've done various tests with all the trackers and they were chunkier wrist-worn ones, I did have them going down here. But you need to be wearing them in the right place to have the best result. And so I am a little bit nervous about the fact that they wiggle around this finger a bit that's bonier, whereas that seems to be the ideal finger to wear them on. Luckily, you only need to wear one generally, but I'm experimenting, so you don't need to.
Actually, it's quite timely that we're talking about your trackers because I want to move on now to the hype cycle. And I would say that back in the 2010s, there was really quite a lot of hype about, I guess like the Fitbit is like the most popular one, right? So Gerry, you studied how new technologies move from hype to disillusionment to eventual usefulness. What can today's students and professionals learn from that cycle?
Yeah, so I think at the moment, obviously, there's a huge amount of hype around AI and big data, and obviously that's having huge impact on the world already. I guess there's questions about, some people perhaps think that AI is going to be a kind of silver bullet, perhaps like Ozempic is going to be kind of Wegovy and things like that. Are these going to be the sort of the magic bullets that are going to solve the health problems of the world? I guess they might have an impact. I think, as they say, if something sounds too good to be true, it probably is too good to be true. So I think there are questions about, are the benefits of big data, AI, how are they going to get translated into practice? When are they going to get translated into practice? Are they going to benefit the kind of the global population? Are they going to benefit health systems? Or are they going to be used to kind of maximize shareholder value and or returns from profits for the companies that are actually building these technologies? So I think there's interesting questions about that. So I think we need to be aware of that. Again, at the moment, there's lots of excitement. It's interesting that Lara's talking about fitness tracking rings. Again, in my mind, I keep on imagining going to a shop to get one. I do track my steps every day. I do look at my cardio data to see how I'm doing. And so I think it's a useful prompt to kind of keep you mindful of your health and of eating well and sleeping well and exercising. I think if we do that, it can make a difference. I think everyone would benefit from being more mindful of their own health data. Perhaps people might worry about it a bit. Again, but I think it's unlikely to be a silver bullet. I think it's likely to have an impact, but I think we need to be mindful of not expecting too much of this and thinking how it might develop in ways that we've perhaps not predicted.
Exactly. And the future is the coming together of so many different technologies. It's taking those bits from various different things and creating a better direction of travel.
I noticed that was a really common theme, is how AI and all of these other technologies can come together to help healthcare professionals give a better analysis of our health and hopefully give better and more personalized treatments. So you work in the media. So from the media perspective, how do you see the hype around AI shaping the conversation in the media? Do you think we are sold unrealistic dreams about AI, biotech, etc.?
Do you want me to answer this from a media perspective or from what I think people are getting from the media? I think one of the issues back in 2023, beginning of 2023, when everyone was starting to talk about AI a lot. Now, I've been talking about AI since long before anybody was interested, but suddenly everyone wanted to talk about it. Everyone wanted to jump to fear and panic. And I think if you were to look on balance as to how people felt about it, fear was probably the main emotion. And for many, still perhaps is. And I think it's important that we tell the story right and with some balance and understand that AI is many different things. Because if, for example, and this was something that did happen a couple of years ago, you have a story about large language models going rogue, ChatGPT writing an essay badly, next to a picture of a humanoid robot, but was the person cheating, even though it was written badly, it can just become a huge muddle. What is the article even saying? What is going on here? And I think it's really important to educate the public, and particularly people who are maybe older or just don't really have any particular interest in the ins and outs of AI, to actually understand a little more about how many different things AI is, how it's acting in different ways in so many elements of our lives. And AI's been all around us for ages, whether it's the streaming service you're sitting there watching in the evening, whether it's your smartphone recognizing your face. AI's doing lots of things we don't even think about. And one of the reasons that I wanted to write this book was because most of the interviews that I did, people would ask questions over the fear of AI. And yes, of course, we get into more detail about what it can do. And, oh, wow, it can personalize a Christmas card or whatever. And we go into these things which were quite interesting to talk about. But actually, to really understand why we built this thing, I believe, ultimately, being able to better democratise education, healthcare, what it can do for the environment, albeit this may open up a whole can of worms as to the damage it might be doing for the environment as well as the good that it can do. But there is so much bigger picture that AI can help us achieve. And it's actually why I wrote the book, because I felt this story needed to be told. These are not necessarily the headlines that people want to read. They're not necessarily the clickable bits of what AI can do well and how it can transform your health. Sure, if it's a matter of being able to diagnose prostate cancer in a day, that will make headlines. But this is an absolute direction of travel. And I know I keep saying that, but there are so many things that fall into this picture of how AI can supercharge health. And I just felt the positive story, the power, the why we built this thing needed to be expressed.
So this is a question for the both of you. Recently, I think OpenAI came out with a social media app, and all of the content on it is entirely AI generated. I guess it would colloquially all be considered like brain rot. In Hacking Humanity, you did talk about how important socializing with others is for your health. That's like one of the most basic aspects of our health we should be thinking about if we want to improve our health span. So given that these apps are coming out and will possibly become more popular in the future, I just wanted to know what both of your thoughts, like for both of you, what your thoughts on the apps are.
As somebody who works in a university, and I've thought about the issue around AI-produced essays, which is something come across our minds in recent times. So my view is, again, I have a teenage son who uses AI, and I've said to him, use AI to help you do things, but not to do it for you. I think AI is a really useful tool. It can be incredibly useful if you use it critically, intelligently, if it, you use it to teach you things. If you use AI to do things for you, then you're going to become replaceable. So I think it's really important how we use it. I think so it's potentially a blessing and a curse. I think you talk about the importance of human connection. One of the interesting things that all this big data is showing us is that basic things like eating good food, like sleeping well, like exercising, like spending time with these people, these are really important. So these are the things we need to be encouraging people to do. Again, I think that there is mixed blessing AI. It can show us incredibly important things, as Lara talked about in her book, around how to live healthier lives, but there are also potential dangers with it. So we need to be conscious of that. But we need to encourage people to live healthier lives. It's better for people. It's better for society. It's something we can do. If we can use these new technologies in a way that does that, I think great. If these technologies are used in a way that undermines people's health, then obviously that's more problematic.
Your question made me think of the stat on how much of the internet is likely to be AI slop by 2030. And I think that's definitely a reality. As one Silicon Valley doctor said to me, who I interviewed for some documentaries actually before my book, humans are the most complicated of things. Interacting with people is so complicated. It's not just a flat, I'm asking this, you're answering this. You're looking at their facial expression. You're analysing everything. You're trying to see when they're bored. You're subconsciously doing so much. And as he described it, your brain is doing all of these mental gymnastics. And that's something which is really hard to replicate. There's a lot going on in the space of AI relationships, even building an AI mother. There is so much that you can do, death bots, to help yourself live on after your demise, or to create it for someone that you're grieving. Is that good for grief or not? I don't know. There are a lot of possibilities emerging, but I think the big question comes in, just because AI can do something, should it? We possibly need to sometimes approach it with caution.
Okay, thank you for your answers. So we've now reached our final section, which is the 2-minute takeaway. The premise is that the academic, so Gerry, talks for 2 minutes about the one key takeaway listeners should remember from this episode. So you can talk about something you're really passionate about, or maybe plug your own research. So the stage is yours.
Great. So as I said, healthcare systems around the world are facing kind of huge challenges at the moment. And technology's here, big data's here, AI's here. It's not something that's going away. So I think we need to think about how we can use it in the way that's most beneficial to society, to populations, to our individual health. Again, at the same time, it's not going to be a magic bullet. There are issues around shifting us towards a more sort of preventative focus, as Lara talks about in her book, as creating a health service rather than a kind of sickness service. So can we think longer term? Can we get people to think about how to prevent people becoming ill in the longer term? I think that's really important. I think there are challenges around both governments potentially thinking too short term. Are organizations that are selling this new technology, are they more interested in their own profits than in longer term benefits to society? There are questions around how is this going to be funded and paid for? But coming back to the original point, it's here. We need to think about how we use it in the best possible way. I mean, to be mindful of the potential benefits and the potential limits. and navigate ourselves to a better future in which technology does make people's health better, whether at an individual or a collective level.
Okay. Lara, Gerry, thank you so much for joining us today on Office Hours. It was really interesting learning so much about health tech and reading your book, Lara.
Pleasure.
And
Thank you so much for having me.
I would really recommend anyone listening to the podcast to read it. This is the first episode of the new academic year, so we've got a lot more content up our sleeves. So make sure to follow at King's B School on Instagram for updates on future episodes. And also please do check out Gerry's research for King's Business School as well. And finally, thank you so much to you, the listeners. We'll see you again soon. Bye.